And here's another impact from the skyrocketing cases. Right now, primary care clinics are just trying to keep up with the demand. And along with an influx of COVID patients, Atrium Health says it's also trying to manage other non-COVID related illnesses, plus wellness exams on top of that. WCNC Charlotte's Tradisha Woodard spoke with some local doctors about how they are pivoting to meet the need of each patient.
Because we are seeing such a rapid rise in Omicron, that we were actually having patients not be able to find care for their sick child.
Atrium Health pediatric primary care says children typically get sick in the winter months.
Even if they don't have COVID, there's still plenty of other respiratory illnesses.
They say along with those other illnesses and the Omicron variant, the influx of sick kids has dramatically increased.
Last week at this time, about 16% of those symptomatic patients were testing positive. By Thursday, it was more than double that. It was over 34% that were testing positive. Because of Omicron, we are at our highest percentage of COVID that we've seen this entire pandemic.
They say it's no different for their adult primary care centers.
I think the number one thing we're seeing is really large volumes of people who need care, and we're doing everything that we possibly can to make sure that we're providing that in a really timely and effective way.
One of the effective approaches they're taking is holding off on untimely procedures, minimizing the amount of wellness exams, and prioritizing sick patients.
What that does is it opens up appointments for people who may need to come in and be identified as COVID positive because they need monoclonal antibody, because they need some other sort of treatment.
They say they're working to manage all appointments in a timely fashion, and they couldn't be more grateful for the community's patients.
We're doing everything we can to meet everybody's needs.
Tradisha Woodard, WCNC Charlotte.
And Atrium Health says that it will reschedule appointments and wellness exams as soon as possible.